There have been a number of advances in detection and treatment. So for detection, we've got the advent of 3D mammography, also called tomosynthesis. If you imagine taking a breast and squashing it like a loaf of raisin bread between two plates and taking a picture, that would give you a 2D mammogram. Now 3D, same squashing, same radiation, so the ladies don't get to avoid anything from their perspective. But now you squash that raisin bread, and what I see on my end is about 60 to 70 slices of raisin bread. So all of a sudden, the raisins are easier to pick. So in terms of what really that translates to, we find 3D versus 2D mammos, find 34% more breast cancers with 17% fewer callbacks, which are these panic moments of like, we think we see something, but it's actually nothing. After 2 weeks later, you find out with more squashing and radiation and maybe an ultrasound or a biopsy that it was all fine. So you avoid that 17% of the time. So 3D is great. Screening ultrasound has really taken its day in the sun now that we understand breast density better. So women who are dense breasted, which encompasses 50% of all women, have a decreased detection rate on your typical mammogram, even with 3D, because density looks white on a mammo, and so does cancer. So now the denser your breast, the whiter the mammogram, and we're looking for a snowball in a snowstorm, and we're just going to miss it. So when you add screening ultrasound, you're going to increase the detection rate. And if you are dense breasted plus high risk for family history, a gene mutation carrier, et cetera, sometimes we throw breast MRI in there much more routinely than in the past. So screening and earlier detection is happening. On the treatment end, we've got some really fascinating advances, particularly in the world of what we term biologic targeted therapy. So one of those would be immunotherapy. Brand name Keytruda, for example, is used in triple negative breast cancers, extending life significantly in stage 4. But now we're using it on the front end as part of the chemo treatment for triple negative, even in early stage 1 and 2. And what we're finding is when I get in there to operate, 70% of the time after they've had this Keytruda immunotherapy, there's no cancer there. It's completely gone. It's called a PCR, path complete response. Another biologic is called a PARP inhibitor. So if you have a BRCA gene mutation, you could take a PARP inhibitor, which stops cancer cells from being able to divide. So they eventually just implode. So there are some great biologics. There are also this world of more precision medicine. So we're using genomics, not of you, not testing you for BRCA, et cetera. That's been around. Actually, since 2015, now we have an array of genes we test for. Prior to that, it was just BRCA. But you can do genetic testing on the tumor itself to figure out what mutations it possesses and maybe be more precise in the drugs that target it. We use also genomic studies called Mammoprint and Oncotype, for 2 examples, that give an analysis of what mutations and gene expression exists in the tumor. And depending on what's good or bad to have, these tests will spit out the percent chance that your cancer is going to recur metastatic, incurable in the next 10 years. And using that information, it can help drive you toward chemotherapy or anti-estrogen, so you make a better informed decision about what treatments to pursue. And then finally, on the surveillance front, my new favorite thing is circulating tumor DNA. So these aren't generic circulating tumor fragments. These are specific to your cancer. They make a blood sample out of your cancer's DNA, and then they come to your house, draw your blood, and run it through this test for however often I order it, usually every 3 months. Because if you're cured, you can never have any of those DNA mutations flying around in your blood because they belong to a tumor that should be in a bucket in a lab somewhere, right? So circulating tumor DNA is another new advance that's helping us detect recurrence about 9.5 months before it's otherwise clinically detectable, like with a PET CT, or you present with bone pain or something that signifies the cancer's back. We get a big heads up with ctDNA. Advances in earlier detection and treatment are exciting to me because we do get a heads up. Smaller cancers are more curable with less toxicities, and better treatments give us better outcomes. But to me, it's all like chasing the cow that's already out of the barn. My true excitement comes in the world of prevention and risk reduction, and that needs a lot of addressing in the medical field. Diet and lifestyle have such a bigger impact on breast cancer incidence, recurrence, and death than most physicians, let alone most patients, have knowledge about. So this is an area of great passion for me because I think people don't realize that only 5 to 10% of all breast cancer comes from inherited gene mutations from mom or dad, like BRCA, PALB2, CHEK2, and maybe 5% is weird fate, inexplicable, like this person's so young, she hasn't even lived long enough, badly enough to explain how this cancer could happen. You know, she's 24 years old. But in the middle here is a massive fat bell curve of literally 85 to 90% of all breast cancer that is neither inherited genetics or inexplicable weird stuff. It is very explicable, and it's explained by nutrition and dietary choices that people make, being overweight versus normal weight, drinking excessive alcohol versus not, exercising regularly versus being sedentary, taking hormone replacement therapy, managing emotional stress, environmental toxicities that we're bombarded with every day, whether or not you fast or have restorative sleep. All of these factors affect what is effectively a tumor cell's microenvironment. It's like a little bathtub that your cells are sitting in. And you want that water that the cancer cell, this now mutated breast cell, as just one cell, is no real threat until you start fueling it with all of the things that it loves. So it loves estrogen. 80% of all breast cancers are fed and fueled by estrogen. It requires insulin-like growth factor 1, IGF-1, the biggest growth promoter for all cancer inside your body, and it must have it to exist and persist. Angiogenesis, blood vessel genesis, birth, so the birth of new blood flow to it. The cancer needs that to get its nutrients, and when it finally grows to a big enough size to escape, it already recruited its blood vessels, just straight to liver, lung, brain, bone, right? So that tumor cell microenvironment is affected by every single thing you chew and swallow down, for better or worse. So what you eat and don't eat, drink and don't drink, move or don't move, think or don't think, all of these factor into that bathtub. And what you want to do is make that water so despicable to the cancer with none of the fuel sources that it needs, that its only recourse is called apoptosis. It's cancer cell suicide. Essentially, it just dies off because it has no fuel. So soy is a phytoestrogen, right? A plant-based estrogen. These isoflavones have names like genistein and daidzein, and it turns out we have two different estrogen receptors in our bodies. Alpha, which is on the cancer cell, 80% of all breast cancers are fed and fueled via an alpha estrogen receptor. So estrogen, say from your own ovary, hits this receptor and sends a signal to the cell to multiply and divide. But it turns out the isoflavones in soy hit and activate beta receptors. These beta receptors do a few fascinating things. For one, they shut alpha down, so it takes away the ability for your own estrogen to fuel that cancer. Secondly, it goes out into our fat cells where we have an enzyme. It's called aromatase, and it's busy all day converting adrenal gland steroids like androstenedione and testosterone. Aromatase turns it into estrogen, estradiol, that real deal estrogen that's going to make that cancer divide. And soy isoflavones zoom out to aromatase and shut it down. So the soy isoflavones, via their action by inhibiting alpha receptors and decreasing the production of cancer-fueling estrogen, are able to decrease the recurrence and therefore the mortality from breast cancer. Remarkably, we don't really understand the true mechanics of how and why, but it's not just the isoflavones and the anti-estrogen activity of soy that is so magical, because we see strong evidence that soy consumption can dramatically decrease recurrence and death from estrogen-negative cancer. So soy also has the anti-proliferative, carcinogenic, anti-inflammatory, anti-IGF-1 capacity to reduce our most formidable foe, which is the triple negative breast cancer. We have the lowest cure rates for triple negative, and yet high soy consumers have less recurrence and death from triple negative cancer. There's 3 ways to think about our interest in how soy can affect breast cancer. First of all, it's occurrence. Can soy consumption just slow it down from ever happening in the first place? And second of all, if you do have breast cancer and it's estrogen driven, is then soy prohibited because maybe it does create a cancer proliferation, or maybe it interferes with the drugs we're giving you? And third of all, if you don't have an estrogen-driven cancer, is there a reason to take or avoid soy, right? So the evidence is very clear that high versus low soy consumption dramatically decreases the occurrence of breast cancer. Few studies, for example, the Shanghai Women's Study looked at over 73,000 Chinese women and found that high soy consumers versus low had 59% less premenopausal breast cancer, which is significant because if you have breast cancer prior to menopause, so generally 50 and under in age, it tends to be a more aggressive, less curable subtype. So we're getting rid of our most lethal subtypes of cancer partly through at least soy consumption. So soy it up, ladies. Do not fear having soy given to your children in the form of tofu and soy milk, etc. BRCA1 mutation carriers have about 70% of their breast cancers, when they get them, could care less about estrogen. So we've got our estrogen negative cancer happening in the BRCA1 population. And in this particular study, again, high versus low soy consumption dropped breast cancer incidence, so occurrence, by 43%. One of the most recent studies is just out of 2020, and I love it because it's from North America. There's 52,000 women. It has 29.7% African Americans represented, a very underrepresented minority in a lot of our studies. And they followed them out for over 6 years. And what they found was that for median intakes, and this is another reason I love this study, your average intake of, do you drink soy milk or do you drink dairy milk? If you chose soy, you will have a 32% drop in breast cancer incidence. A lot of the high versus low soy consumption is surprisingly wimpy, but for the majority, we're talking about a serving a day versus less than that to none of that. It's not, in other words, it's not a high level of soy consumption that we have to advocate for to drive all these benefits. Okay, so that's the drop in occurrence. Now, what if you have breast cancer, particularly if it's estrogen driven? Should you now avoid soy? Will that be bad for you? Will that interfere with drugs like tamoxifen or aromatase inhibitors that we give you? The short answer is no, it won't interfere, and you absolutely should consume soy because the evidence that didn't start pouring in humans came in 2009. And from then onward, every single human study ever done looking at soy consumption and breast cancer recurrence and death has shown nothing but a decrease, on average between 25 and 32% decrease in recurrence and in death from breast cancers, whether they're estrogen positive or negative. So any fear-based avoidance of soy really needs some facts put behind it, so that physicians and consumers of soy can feel very confident about recommending soy consumption, because it's not neutral, and that's what gets me. I don't really care if you're not consuming something that has no effect whatsoever, causative or preventive. What do I care if you eat that, right? Probably like cardboard. It's not gonna make a difference. But soy is preventive and it's risk reducing in terms of recurrence and mortality. I need you to understand that 2 to 3 servings of soy daily is one of the most impactful breast superfoods that you can be consuming. As a physician, I don't really see the adolescent population directly, and I can't speak to how much soy avoidance there might be, but I do know they're moms. And the mentality, for the most part, is that soy is either an unknown or it's dangerous for consumption in adolescents. Because it's a plant-based estrogen, there is this misconception that it may create precocious puberty, early breast development, and none of it is true, right? In 2021, Dr. Messina published a beautiful study, a meta-analysis of 417 human, keyword human, studies that looked at exactly all of these factors and found that in no uncertain terms, soy is not an endocrine disruptor. It doesn't mimic other hormones in your body in a disadvantageous way that's going to cause harm. Whether we're talking about your thyroid or your breasts or your prostate, there is no harm and usually defined benefit. Where did all of this misconception come from? I can only speak truly for myself because, embarrassingly, for 18 years, I told all of my patients to spit the miso out of their mouths, and I thought soy, being a plant-based estrogen, would then activate that alpha estrogen receptor. I didn't realize there were two different ones and how a different mechanism, and I certainly didn't realize that we as human beings metabolized the isoflavones in soy wildly differently than our little lab rat. So there was one study that I had heard of where they grafted human breast cancers onto mice and fed them soy, and the cancers grew, and boop, that's all I needed to know to tell every single patient, you kidding me? Like, how much do you love soy? Just spit it out. Forget about it. Do something else. Almond milk. I don't care. Just no soy for you. 18 years I spread that falsehood. And it was largely based on minimal amounts of information that soy contained estrogens, and that when you fed said estrogens to mice, breast cancer grew. And there my knowledge stopped. And that's where all of my advice came from. When patients ask me how isoflavones relate to the hormone estrogen, I say, you're absolutely educated and right. It has a chemical structure that's very similar to estrogen, but it turns out that we have two different estrogen receptors in our bodies. And your breast cancer loves alpha receptors. Soy kind of could care less about alpha, and it's all about beta. And then I explain the difference in how receptors affect cell function. So they feel liberated by that explanation and can go home and pour a glass of soy milk. I advocate that women, whether they have breast cancer or not, so all women, consume 2 to 3 servings a day. So a serving would look like a cup of soy milk or a half a cup of tofu, edamame, tempeh, or a quarter cup of soy nuts. That's a serving, 2 to 3 a day. Some of my favorite ways for women and men to get more soy in their diets. One is, I happen to have an anti-cancer smoothie that the base of which is a cup and a half of soy milk. So boom, right there you got 1.5 of your 3 servings done. And it has like 2 cups of berries, 2 fistfuls of greens, flax seeds, amla, the Indian gooseberry. A number of anti-breast cancer components go into every single one of the ingredients in this smoothie is an anti-breast cancer ingredient per the science. So my smoothie is like a go-to for my breast cancer community. I want them to have it at least 3, if not more times a week as a meal replacement, as breakfast. That you can just Google online, the recipe's everywhere. There's no secret to it. And other ways, tofu, you can bake tofu or stir fry some tempeh and put that into a rice bowl. What else? Edamame is a fantastic healthy snack. It's really easy to start incorporating. You could just do soybeans or even soy nuts sprinkled onto a salad. There are a number of really basic ways to consume tofu. So you can chop it up and bake it and put it into anything from a burrito to the rice bowl or a Buddha bowl. But one of my favorite ways is I make a breakfast burrito that just crumbles up just with your hands. Put it in, saute it up with some onions and peppers and mushrooms and put avocado and salsa on top. And it's like the most delicious burrito or little bowl for breakfast. My kids have it all the time. So it's easy. Once you open your eyes to the need to consume soy, figuring out how to incorporate it into a breakfast, lunch, or dinner is very Googleable. I have a small but growing number of breast cancer cases in which I employ diet and lifestyle changes while the cancer is still there. Now, I want to qualify that every single one of these patients has had an estrogen-driven tumor with a slow division rate. So they weren't going to spend these next 6 months with me doing an intervention that could be potentially deadly. And I followed them every single month with repeat ultrasound to make sure that the tumors are shrinking. And every single one of them was on an estrogen blocker, a prescription drug, right? But that alone, we already have in our Western medical world. This estrogen blocking drug alone doesn't reverse breast cancer down to no longer there when I operate. So they're on that, which is effective, but not completely. And then I have them eating a completely plant-based diet, exercising regularly, fasting regularly on a daily basis and on a prolonged basis, meditating, a number of interventions. And I have a solid handful of proof positive before and afters. Here's the cancer, biopsy proven. I still need to operate, but maybe what was a mastectomy with a 3.5 centimeter cancer in a 15 centimeter span of in situ, which is a real case. All the in situ disappeared, and her 3 centimeter invasion became a couple specks of invasion, and I did a little lumpectomy, and she got to keep her whole breast, which was definitely a goner the day I met her. And we reversed all of that. She did all the work, but I gave her the plan. Right? So I know the power in dietary and lifestyle changes. Yes, probably with the addition of some amazing Western medicine pharmaceuticals, but not the ones that are going to knock you flat on your back and make you bald, right? These are fairly tolerable medications. It's amazing what the combination can do. Soy is not just anti-estrogenic in the anti-alpha estrogen receptor way. It is also anti-things that cancer needs, anti-angiogenic, anti-proliferative, anti-inflammatory, in such ways that the estrogen-negative cancers greatly benefit from soy consumption, perhaps even more so than the estrogen positives. So there was one study published in 2017, looked at 6,200 breast cancer patients, and they were followed for about 8 years. High versus low soy consumers had a 21% decrease in all-cause mortality. So that means just dying from anything. The estrogen positive patients, so those who weren't on tamoxifen or aromatase inhibitors, they had a 32% decrease in recurrence, and the estrogen negatives, 51% decrease. So soy was even more powerful at preventing recurrence and death in our estrogen negative population in that particular study. Absolutely, whether positive or negative or no cancer yet at all, soy consumption is safe and effective and highly recommended to be consumed before, during, and after a breast cancer diagnosis.